Two of them are my students. I'm actually a school nurse, so I deal with injuries all day. So first we'll start with basic first aid. So a lot of times we think of these things and it kind of seems like overwhelming, but it's actually very simple. Things that we use every single day, right? Like washing our hands and things like that, keeping things clean. That's what we want to focus on. So say something simple like you go and scrape your knee. What are we going to do?
Clean the wound and bandage it.
Exactly, right? And why do we cover it up?
Oh,
Go ahead.
because we don't want it to get infected.
Exactly, right? So once you have this open skin, now you can introduce bacteria, right? Same reason why we wash our hands, right? To prevent bacteria from spreading. So you always want to make sure that like a simple scrape or something like that, you want to make sure you clean it. Soap and water is usually best. And then you're just going to cover it up. So we'll go through the first aid kit we have here. Most of the things are Band-Aids, gauze pads. We're gonna have hand cleansing wipes, right? So before we do anything, we should wash our hands. And you may not have soap and water to wash your hands, right? So taking one of these before you actually start cleaning your wounds would be really helpful, so that you're not introducing the bacteria you have on your hands already to an open cut, okay? This one probably doesn't have gloves. Oh, it actually does. So another thing is you want to make sure not only are your hands are clean beforehand, using gloves when they're available. You want to make sure that you're covering your hands too, okay? So let me see. So this kit doesn't have it, but some of these kits have like something to cleanse a wound when available. So I use a spray at home, and it's like an antiseptic spray. It's just something to clean the wound with, okay? So the one that I have, it doesn't sting at all, and I actually keep it in my car because my girls won't let me touch them without this spray. So you would just spray it. If you don't have, that's if you have this. If not, you're gonna use soap and water. You're just gonna spray the wound, cover it up. Another thing is, so do we know why we use ice for certain injuries?
So that it doesn't overheat.
So it's actually because it reduces swelling. So say if I use ice all day at work. These girls can probably tell you. They don't visit the nurse often actually. But I use ice all day at work. So if there's a student that say they hit their lip. So I had a student the other day who kind of just bumped their lip on the end of the table at lunch. Their lip was extremely swollen, right? And they had 8th grade pictures the next day. So first thing I did was, after I cleaned that area, we just cleaned it with water because it was around the mouth. I applied ice to it. We sat there with ice for 15 minutes. That swelling, his lip went from being huge and it looked like the normal size. So of course you're not gonna have ice cubes handy at all times, right? But sometimes first aid kits have these instant cold packs, and I'm not gonna use this one because I don't wanna ruin it, but what you would do is you're just gonna squeeze it or bang it, okay? And it's gonna get super, super cold, and sometimes you kinda have to, what do you guys call it when you play with slime? I can't think of that word that you guys use. But anyway, when you're like constantly squeezing it together, that's what you're gonna do. It's gonna become really cold. It's gonna feel like there's ice inside, okay? So that's gonna help with swelling, and it actually helps with pain too, okay? All right, so there's a couple other things in here. This pack actually has emergency, it's a step-by-step first aid guide, which is nice. So, right, so when you're having questions, if you don't have anyone available, you could always use one of these. So those are just the simple first aid things, right? So like keeping the wounds clean and all that, that's all stuff that you guys pretty much know. One major thing is food allergies, okay? So you all go to school, right? Mm-hmm. Are you guys aware of like some certain students that have peanut allergies in your
there's
school?
this girl on my Girls on the Run group who has a peanut allergy.
Right.
So we can't bring like anything with peanut.
Exactly. So a lot of schools are either peanut free or peanut friendly. Our school is peanut friendly, but our classrooms are usually peanut free, where we can't keep we can't take peanuts into the classroom if there's anyone with a nut allergy.
Same thing with my girls on the run.
Right, exactly.
You can't bring anything with peanut butter.
Exactly.
Or like just peanuts in general, or you can't bring anything in a factory that
Exactly, right. That it was even made around peanuts, right?
Yeah.
Because they're scared of cross-contamination, meaning they're scared that something with nuts was exposed to this food item, okay?
Mm-hmm.
So, do we know what happens when someone that has a severe food allergy, what happens when when they eat or even are sometimes around that allergy?
They need like an EpiPen, right? I have an
Yes.
EpiPen.
Do you? What's your allergy?
I'm allergic to like avocado.
Okay. See, there's all kinds of allergies. It's not just peanut allergies. Peanuts is just one of those main allergies. So we're always looking for this peanut friendly, peanut nut free. But any allergy can turn into what we call an anaphylactic reaction, which is when your body goes into shock. So I'm going to tell you guys first how you would recognize an anaphylactic reaction. Some people there's just slight symptoms until it becomes severe. Other times it goes into straight, you just start having severe trouble breathing. But one thing, so we always want to make sure that we're obviously not bringing any kind of food around someone that has this reaction. However, if we are concerned, we're going to look first for symptoms like swelling around the mouth, difficulty breathing, hives, swelling around the face in general. People, a lot of times I hear like throat itching first, so it almost feels like you have a sore throat out of nowhere, and then it goes into kind of like serious trouble breathing, and a lot of people explain it as like a tightness in their throat, which it can actually happen where their airway closes and they can't breathe. And that's where this comes into. This is a trainer, this is not real. So I'm going to show you guys what it is. This is what an EpiPen normally looks like, but this is a trainer, so it's for practice only. See, there's no actual needle in here. I don't want you guys to be alarmed when I stick myself. So most EpiPens look this way. There are many different brands, but for the most part, they look this exact way. It's a long container, and there's usually a cap here. The bottom part, this is like the needle, where the needle would be. So normally, if we ever needed an EpiPen, which anyone can give, okay? I have had students tell me that their parents have a severe allergy, and they are trained on how to give an EpiPen to their parents if needed. This is not something that a nurse or a doctor or a firefighter needs to do. Any single one of you could do this if you're comfortable, okay? Now, it's nothing to play with, of course, but I'm just saying that you are capable of doing this, and this could save someone's life. And it's super easy, I promise. As scary as it may be, it is very easy to use. So, I'm going to pretend this is the EpiPen, okay? Every single one has a cap here. This is kind of that safety net. So, if I kept this on, no matter what I do, it's not going to stick me. Okay, so the number one thing, and most of them also have instructions on them. So even when you're panicked, you can literally just say, it's going to say, remove blue safety cap, okay? So you would just remove the safety cap. At this point, it is ready to use, okay? Normally, they say you're going to go straight into a fatty area of your body, okay? So our thighs are bigger. That's normally where you're gonna go. Do you know if you have to remove the clothing or if you can go on top of the clothing or not?
I think you remove the clothing.
No, you don't have to actually. And it's one thing if I have a huge coat on, right? Like if I have a puffy coat, that's something I want to remove. But if I have pants on, any kind of pants, sweat pants, even thicker pants, you can go straight through with this, okay? So what you're gonna do, you remove that cap, right? You know that I'm having an anaphylactic reaction. All right, all you're going to do is you go straight into the leg. You're going to hold it down for 3 seconds. Okay, 1, 2, 3, remove. That medicine is in their body, okay, even through their pants. At that point, what do we think we're going to do? So it's an emergency situation, right? We gave the medicine. What do you think you're going to do?
You help them and you calm them down.
Yeah, that's great. That's
and
great.
And then you call like a medical expert.
Yes, you call 911. So no matter what, even as a nurse, right? Even if I know what I'm doing, if I ever had to give epi to anyone, I'm gonna call 911 no matter what, the second I've given it. Because sometimes so while this may help, and it really can, when you're having trouble, that swelling in your throat, it can go away immediately. But they always need to see expert, they always need to see, go to the hospital in the emergency room, okay? And I always say, if someone, so I understand that this can be super scary. I'd rather be safe than sorry and give an EpiPen at the first sign of a severe allergic reaction. So if you're not getting oxygen in, do you know what happens to your face or your lips? Do you know what color you would turn?
Blue.
Yes, exactly. You're not getting enough oxygen in, okay? So blue lips, all right? That's a very quick sign that someone's having trouble breathing or having difficulty breathing and not getting enough oxygen in. I know that this sounds super scary, girls, but it's just good to know just for the future in case you ever needed to use it. Does anyone have any questions about the EpiPens? No? All right. So I wanted to go over another thing. So say, I'll give an example. Say there is a person that falls outside, right? And they have a really big cut on their leg and it is bleeding a lot. What do you think we're going to do? Absolutely. You can always call 911 without question. I call 911 in a heartbeat if I had any concern. And guess what? If the ambulance comes and the person doesn't need it anymore, that's fine. But you did the right thing, right? Because now they have this expert care and they have in an ambulance, they have everything you possibly need to take care of someone in an emergency situation. So if they get there and the person doesn't need emergency care anymore, so be it. It's fine. You made that right call because you made the decision, right? To say, you know what, they may need this emergency care. But one thing I like to say, if someone is bleeding a lot, you just have to apply pressure. That's what's going to stop the bleeding. You know, you get a paper cut and you're like, oof, where you go and you put your mouth on it, right? Even though it shouldn't step. You just want to stop the bleeding. That's the same thing with any kind of cut on your leg or anywhere in your body, okay?
It's like a hangnail, you accidentally pull it.
Right, and then it's bleeding and you're just kind of holding pressure. Or sometimes you put that bandage on to stop the bleeding. That's what we need. We need to apply pressure to bleeding, okay?
That happens all the time.
Yeah, I know. So that's another thing, bleeding. You really want to hold pressure and don't ever hesitate to call 911. You guys are young, right? You guys are super young, so if all you do is call 911, you have saved someone's life. Okay, that's one thing that I like to get through my girls' head, and I even practice. I know this sounds silly, but I wanted to show you guys. At least on iPhones, I know there's an emergency button. Do you know about that? Yeah. So if you get on my phone right now, like for example, if you get on my phone, you don't know my passcode. Can you go to try to open it up? Oh, well, actually, sorry, it was open. Let me see. No, it's because I have my watch on. I'm not sure if like Androids have it. Right. So go ahead, now you can do it. Oh my goodness, why is it not? Sorry. I swear, it is now, of course. Okay, so on her phone, I'm going to try to type it. I don't know her passcode, and I don't need it. Because no matter what, I see this button here, it says emergency call, right? I can click that. It's giving me her contact, her emergency contact, and the option to dial any phone number. All I have to do is press 911 and press call. And guess what? You don't need their code. I have practiced this with my girls since they were like 3 years old because I want them to realize how simple it is to call when you need help. Okay? And it's something that everyone should know on mine. You would see all of my emergency contacts, but really what I just want them to know is how to call 911. Okay? When you call 911, they're going to ask you for information. You may not know everything. That's okay. You tell them what you know. Okay? So if you know you're at Resurrection, but you don't know the address, you're just going to say, sorry. Thank you. You're just going to say, I'm at Resurrection. It's a school. It's a church. I don't know where it is, but guess what? They're going to find it. Okay? All right. You had a question, Siggy. I'm sorry.
It's not a question, but because I have not had that way, I have an iPhone,
Mm-hmm.
Does it say that? Like, it's like a search code, just like a search code.
Okay, yeah, and every phone is different, but it is something I like because a lot of phones, there may be a different setting, but a lot of them do have this emergency.
Android has it too.
Okay, right, exactly. So I figured because they have everything before iPhones. So, even though I'm an iPhone girl, but it's just nice to know you have that emergency option. No matter what, if you see a phone laying down, it's okay. You take that phone and you call 911 if you're in if you are just in fear of anything. Okay. All right. Is there anything else you wanted me to go over? I have questions.
Heimlich, choking.
Oh, yes. All right. So, who knows so if you're choking,
Oh, I know.
so you know you can't speak when you're
It's the
choking, right?
Heimlich maneuver.
Yes. So that's what it's called. That's what we do to help someone that is choking. Do you know you can't speak when you're choking?
No.
Because your airway is closed right now. So there's nothing I can do to tell someone that I'm choking with my
Like
words.
some people like say they can't breathe, but
Yeah.
if they're speaking,
They can breathe, yes.
We learned that from the firefighter.
I was gonna say my dad's a firefighter, and I was gonna say if my dad could hear you say that right now, and that's probably something they say all the time in my house. If you're breathing, if you're talking, you can breathe. But so I can't breathe, right? But I know I'm choking right now. What should I do? Does anyone know the sign? Yes. Okay. So this is one major thing to know.
And then you
If you are
press.
choking, you're just gonna go like this. Okay, and that is gonna tell the majority of people that you are choking. And so when someone is choking, you're going to be doing something called the Heimlich maneuver.
Yep.
Unfortunately, I have had to do it before. Do you want to be my? Come here, girl. So, Miss Ronnie, right? She just told me that she's choking. All right. So she told me she's choking. So, for a child, this is gonna take. I'm not gonna hurt her at all. I'm not even gonna touch her. But I'm gonna show you guys how to do it. So, Miss Ronnie is choking, okay? And I need to help her right now. I'm gonna go from behind her, right? And I'm going to. So, say this is her body. I'm gonna bring my fist like this, right? Because I need to be able to have my fist need to be really strong to kind of get whatever is lodged into Miss Ronnie's throat out. So I would go around her, I'm sorry, okay? And I would just push it up right under the chest, right under the breastbone, okay? So this hard bone right here, that's what you're gonna go up against, okay? And it may not work the first time, okay? Sometimes you have to do it 2 or 3 times. I have a really scary story. My nephew was choking on an airhead.
Oh.
Yes, in my house. He decided to ball up an airhead, which please don't ever do. I'm scarred for life. He decided to ball up an entire airhead, and it got stuck in his throat. The first time I did it, it did not come out. I had to do it 3 times. Right? 3 times before it came out. I thought I broke his ribs, honestly. And sometimes that stuff happens, but guess what? A broken rib compared to your life, it's well worth it. You can break my rib anytime if you're helping me, if you're saving me. Do you understand? So I know it's very scary, but it's so important to know. And you guys, I mean, if you guys even wanted to practice on each other, it's up to you. It's not something you don't have to, I know it may feel a little silly, but it's really just a quick thrust. So you really want to go hard. You want to, I know it feels like you're going to hurt someone, but it's okay. All right? So again, I would go around Miss Ronnie, and I would just gently, well, not gently, I would be as hard as I can, and I'm just going to go right around her until she's speaking or crying or whatever it is, until you see that the object. Exactly, because it's not just food. It can be an object.
Yeah, it could be like anything.
Exactly.
It could be like a pen tab. It could be anything.
It could be anything. Coins. That happens a lot with kids.
Oh, yeah, coins.
Yeah. So. Oh yeah.
She was 3 years old. I had to take her to the hospital. They looked her up. So there's nothing up there. They were like, where's the button go? What's that home?
Oh my goodness. Listen, the stories, believe me, I've heard. And then again, so this is another thing. After someone chokes, if they look okay, they feel okay, that's fine. They don't have to go. We don't have to call 911, but we can say, why don't we head to a doctor to get evaluated? Okay. If they're still not feeling well afterwards, you just dial 911. Okay. All right.
You guys have no? I think there are questions. They might have some questions for you.
London, right?
Yes.
Yeah,
Okay.
I'm gonna ask one of those questions.
Okay.
How do you handle asthma attack?
Okay, so asthma, I see this all day at work. A lot of kids have asthma, a lot of adults have asthma. There is a certain medication that you need to treat asthma, okay? So if I know that someone is having an asthma attack right now and they don't have their medication with them, what am I gonna do?
Call 911.
Yes, right? Like if they're having a lot of trouble and it's an attack, meaning they're having severe trouble, you're just gonna call 911. But if they do not, does anyone have asthma here? No?
My
Okay.
cousin has asthma.
I do.
One of my
So,
friends have asthma.
I use something called an inhaler,
Oh yeah.
and it's a medication. It's a medication that.
Oh, and one of River's other patients has had inhalers with.
Yes, right. So this medication actually. So what happens with asthma? We have something called bronchioles in our lungs. It's very extreme. But what happens is our lungs become very tight. Okay. The medication that we use. So we actually. We inhale it, and it's just a mist. So it's amazing that you're like, how is this helping? It's like an emergency med. It's really just the most amazing thing in the world. When your lungs are tight, it actually opens up your airway. So that tightness, it expands, and now you're easily breathing in and out. Versus breathing into, say you're breathing into this, or you're sucking, you know those little coffee stirrers, right? Imagine drinking coffee out of that. Right? It's like hard, you're really working to get that out.
Like you're blowing a balloon.
Or right, exactly, with that tiny little, exactly, that's great, girl. So say you're blowing that balloon with that tiny coffee stirrer that has that very small hole. I'm gonna be there forever, right? But if I take a larger straw and I blow through that, it's gonna be a lot easier. It's the same thing with your breathing. So if I'm breathing through this very constricted, is what we would call it, just a very small hole, it makes it challenging. But once we take that inhaler, it opens up our lungs, and now it's like we're breathing through a bigger straw. Okay. And again, so there's all kinds of different treatments for asthma. Sometimes it's so severe people need pills and injections. There's all kinds of things, but the standard treatment is albuterol, which is just that inhaler. And most people take it with that small pump. You would take 2 pumps, so it'd be, I teach this all day, right? So I literally, I do pumps, so I would say on 3, you're gonna inhale, so 1, 2, and I would hold it in my lungs for at least 5 seconds
So you're like
before
holding your breath
expanding.
under the water. for
Yes,
like 5 seconds.
You're gonna hold your lungs, you're gonna hold your breath for a while because you want that medicine to stay in your lungs. And then you breathe out. And then I would wait a minute in between, and then I would take that second puff and do the same thing. 1, 2. Okay, because it takes a little while for the medicine to work. Normally within a couple of minutes, people are feeling relieved, but sometimes it takes a little longer. So while they may be feeling better sooner, sometimes it takes a little while longer. Sometimes it takes 30 minutes. Sometimes it takes an hour before they start feeling better. But if they don't feel better, you need to see a doctor. Okay, so there's a lot of times that I have students, especially with this weather right now and with seasonal allergies, I see kids a lot with taking their inhalers and they're not responding to it, meaning they're not really getting better. So I can only give 2 puffs because that's what the doctor ordered. So at that point, if they're not feeling better, I'm calling their parents and saying, listen, they're not feeling better right now. They're still wheezing, which is that high-pitched sound that your lungs make when your airway is tight.
Like whooping cough.
Yeah, sometimes it's kind of a sound like that. Yeah, not so severe, but sometimes it can be. So now I'm calling their parents and saying they're not responding. It's time to see the doctor. Okay, and I even do that both with my girls. My youngest has really bad asthma, where there's times that she's just not responding to her inhaler, and we're in the ER at 3 o'clock in the morning because she's struggling. So it stinks, but it's very treatable. But if you don't have an inhaler with you, because a lot of times you don't know you have asthma until it happens, right? So a lot of times you need to see a doctor first to get diagnosed, and sometimes it takes an emergency room visit before you can actually get the medication that you need. Then after that, you have it, and you're usually okay. Okay. Anything else?
You guys have any other questions?
Yeah. Do you take training sessions or trials?
Me?
Yeah.
Actually, so I do not. I still do trainings here and there, yes. But for the most part, I went to college for 4 years to get my degree. So I actually went to nursing school where I'm going to learn all of my nursing. I learned everything in the book, and then I actually practiced it in the hospital. And then once you become a nurse, like a registered nurse, then you kind of get all the training you need in the hospital to really learn everything hands-on. But we're constantly keeping up with our practice. We to renew our nurse license, we have to do training. We have to prove that we've done training every 2 years. So it's constant training. We're always learning, kind of just like you guys. Like we're always going to be students. Okay.
Erin, how about you? You have a whole bunch of stuff written down there. Anything she didn't cover?
You do when a student like in the middle of sentence and
So it depends.
Well-
Because that can be it can be something very severe, or it can be something. I mean, either way, it's a serious matter. My first thing I would do is to check to see if they're breathing or if they have a pulse. Do you know what it means when I say have a pulse?
Yeah, like if your heart's beating.
Yes, right. So if your heart is beating, you're gonna feel a pulse. There's so many places on your body where you can feel a pulse. But here, if you just put your two fingers on this area in your wrist. Do you feel that? You can even put it on mine. Do you feel it? Here, I'm gonna have you remove yours, London. Sorry, just for a second, so Erin can feel. Do you feel that? That's my heart beating, okay? My heart is beating. I have a pulse, yes? So at that point, I'm breathing, I have a pulse, okay? I can calm down a little bit. But if I do not have a pulse, or if I'm not breathing, do you know what I'm gonna start? Do you know what it's called when someone's not breathing or someone doesn't have a pulse and their heart stops? What we have to do? Starts with a Z. CPR. Have you heard of CPR? And it's chest compressions. That's intense. I'm not going to get too in detail with that, but that's something that you learn as you're older. Okay? But if I don't know what to do, what am I going to do? Yes, exactly. When you're older, sometimes in high school, we'll have classes to teach the students. Yeah, when I was in high school, I had my first CPR class. They trained all the students, and it was free, so it was nice. But now I knew what to do when I was just 16 years old. Okay, that'll be something you guys can eventually get to, absolutely. And maybe it's something even if you're still in Girl Scout, that would be so awesome for the kids to do.
It would be.
But they kind of they go over.
Like practicing like a dunk.
Yeah, that's exactly what they do. But even so even if the student faints right while in the middle of the sentence, and say they have a pulse, and what would you do if that happened to you right now, someone in the middle of the sentence, and just passed out? Call 911. Yep. It's that simple. Yeah, exactly, and that's what they would have you do until they get to you. Good. Very good. Any
Okay.
other questions?
You guys have any questions?
Heartburn? The good thing about heartburn is it's not serious. A lot of times people get heartburn just after eating something spicy or eating something too fast. It's just really uncomfortable. There's medicine for it, like Tums, where you can chew. It's a chewable tablet. Sometimes they say milk helps too, though. But that's not an emergency situation. But if someone says they have chest pain, what am I going to do? If they feel like they have chest pain and I'm hunched over, just call 911. Yeah. My main thing is I want you girls to know you don't have to be afraid to call 911. If you're in fear that something bad is happening to someone, just call
So what do you guys say?
Thank you.
You're welcome. You're welcome.
Thank
Of
you.
course, of course.